What if I told you that you could get the results of a facelift without surgery? Imagine a short trip to the clinic during your lunch break to look 10 years younger. Would you sign up on the spot? Or would you listen to your inner skeptic and wonder, if it sounds too good to be true, maybe it is? Is there really such a thing as a non-surgical facelift? A lot of advertising dollars have been spent trying to convince people who are concerned about signs of aging that there is a non-surgical facelift, and there's a lot of interest in non-surgical treatments out there. Patients often ask, how do I lift the cheeks and the jowls without surgery? Well, the honest answer is you can't. As we delve into non-surgical treatments that exist to help lift the face, we need to keep in mind their limitations and potential drawbacks. Could you be damaging your skin by pursuing a non-surgical lift and making it harder to achieve a great surgical outcome down the road? Stay tuned to find out. And make sure to check out feelconfident.com for our latest skincare and hair care treatments. When people talk about non-surgical facelifts, they're usually referring to 4 different categories of treatments. Injectables such as fillers or botulinum toxin, threads, and I'm not talking about the one from the Instagram team, microcoring, and high energy devices. Let's look at the most famous and infamous category first. Injectables. Fillers, biostimulators, and botulinum are all injectables, but they do very different things and have different safety profiles. Fillers come in 2 categories. The first are temporary solutions, including hyaluronic acid, which is the most common and is largely reversible. Others in this category include collagen, calcium hydroxyapatite, and Sculptra. The other category is for more permanent or semi-permanent fillers. One example is silicone, and another is art film, or PMMA, which are microspheres suspended in purified collagen. Fillers, particularly HA fillers, are often advertised by manufacturers as a liquid or a non-surgical facelift. But there's no such thing as a true non-surgical facelift. You just can't combat gravity and reposition tissue without surgery. So what can fillers do? Fillers can be used to strategically mask volume loss and deeper lines of the face, such as the cheeks, lips, and temples. Used sparingly, they can help improve someone's appearance. So what don't fillers accomplish? While replacing volume can at times look natural, too much volume doesn't lift the face. It inflates it, leading to an unnatural look. What are the risks of trying to lift the face with fillers? When you try to lift the face with filler, you run the risk of overfilling, looking unnaturally full, and even developing scar tissue. More on that later. There is also the risk of stretching the skin permanently, so even when the filler wears off, the tissue is modified. We've seen this with overfilled lips, and we talk more about it in this video. Remember that filler can also have a rare devastating complication of vascular occlusion, causing skin death and possible blindness. Another major downside is the cost that adds up over the years, and frequent touch-ups are needed. Patients can end up unsatisfied and often still opt for cosmetic surgery. If you're enjoying this video, please make sure to like the video and subscribe to the channel. Thanks. The other type of injectable is botulinum toxin. Referred to by one of its brand names, Botox, it acts to paralyze muscle and is often used in combination with filler. Like fillers, botulinum toxin can't lift the face. Paralyzing the muscles just won't do that. So what can it do? It can partially elevate the brow by paralyzing the muscles that pull brows down, resulting in a more alert, less tired appearance. But it's not a true lift as often advertised. It can reduce wrinkles from animation, leading to a less furrowed forehead. It can also reduce frowning around the mouth. Sometimes it's used to decrease the size of the masseter muscle, leading to a less prominent jaw. And it can reduce the prominence of neck bands. Botulinum toxin can do a lot of great things to reduce the signs of aging, and its safety profile is quite impressive. Plus, it's a relatively inexpensive treatment compared to some of the other non-surgical and surgical options out there. But it's not a replacement for a brow lift or a neck lift. What about collagen biostimulators? There are 2 commonly used collagen biostimulators. The first is Sculptra, or poly-L-lactic acid. This is a synthetic material that's absorbed by the body over time. It stimulates fibroblasts to make collagen through a foreign body reaction. The other collagen biostimulator is Radiesse, which consists of calcium hydroxyapatite microsphere gels, and it works in a similar way to Sculptra, stimulating fibroblasts to produce more of your own collagen. So with these injectables, oftentimes the results are not seen immediately, and it takes many months to start to see some of the benefits. But again, it doesn't truly lift the face. The next non-surgical lifting strategy that we'll be discussing is threadlifting. They were briefly popular in the late 90s and 2000s until complications from permanent materials made them fall out of use. They've had a resurgence with dissolvable sutures, but many of the same problems persist. The idea is to use dissolvable barbed sutures to lift skin. It's often used to get a fox eye effect, for example. The procedure, though, is more trouble than it's worth. It's expensive, short-lasting, and it can lead to infections and skin irregularities. They can also cause scarring of the deeper tissues with repeated applications. And people are often disappointed with their results. You never see a long-term beautiful thread lifting result online or at a conference because they just don't exist. Microcoring technology is another non-surgical way of tightening or lifting the facial and neck tissues. This is a newer modality in which hollow needles are inserted to remove microcores of skin. It's often advertised as deleting sagging skin. While overall a relatively safe modality, whether it actually does any lifting is still far from established. We have a video where we go into a lot more detail on this topic. The next treatment type on our list of non-surgical facelift options is energy-based devices. They promise to remodel and tighten the skin by heating the deeper layers of the skin, just in slightly different ways. Examples of energy-based devices include radiofrequency, with or without microneedling, such as the FaceTight machine, and ultrasound energy, such as with Ultherapy. So how do these work? The monopolar radiofrequency or RF devices are different from cosmetic lasers as they produce an electric current rather than light to deliver uniform heat at controlled depth to dermal layers. Ultrasound-based treatments basically do the same thing, but by using ultrasound waves to deliver energy. Remember that heat is the byproduct, and electromagnetic fields and ultrasound waves can generate that heat. As the local temperature within the dermis, subcutaneous tissue, and fibrofatty septum reaches 65 degrees Celsius, collagen is denatured, leading to immediate collagen contraction and the stimulation of neocollagenesis. You're basically cooking your collagen, and subsequently that same collagen gets remodeled and can give a tighter appearance to the skin. That remodeled collagen is not always organized collagen and can be considered scar tissue under the skin surface. And that in turn leads to problems when performing surgery such as a facelift, and I'll get back to that later. While radiofrequency and ultrasound treatments can lead to some degree of skin tightening, they're really not an alternative to a facelift. The results are not nearly as dramatic. These energy-based treatments are not risk-free. There are immediate complications that can occur, such as burns or nerve damage, and in the long term, some patients experience a reduction in fat quantity, which then can make them seek out procedures such as a fat transfer to replace the cooked fat. And many plastic surgeons are sounding the alarm about these high-energy devices because they can change the quality of the tissue, and that can in turn affect surgical outcomes. The collagen of the dermis is getting remodeled in such a way as to make surgery more difficult. Tissue planes are harder to find, the tissues tend to be more fused and more difficult to dissect or separate and manipulate into their new positions. This makes it harder for your surgeon to generate excellent results and potentially increases complication rates. In conclusion, increasing normal, structured, healthy collagen is a good thing, but unstructured, crunchy, fibrotic collagen is not the same thing. And unfortunately, most of these non-surgical lifting procedures do just that. They increase the scarring under the skin surface. This in turn makes future surgeries more challenging to perform, making it harder to achieve beautiful outcomes for our patients. Patients then often regret these non-surgical procedures that they previously had, and they often wish that they would have had surgery surgery sooner. But we also need to keep in mind the real risks of surgery, and we shouldn't try to over-glamorize it. It can be difficult to decide which avenue to take for facial rejuvenation of an aging face. Now that you have this information, which would you prefer for a more lifted face? A non-surgical approach, a surgical solution, or a combination of the two? Let us know in the comments below.